Anovulation is a condition caused by hormonal imbalance where a woman does not ovulate. So is it possible to have a period and not ovulate? Yes, very possible. Ideally, a period happens about 10 to 16 days after a released egg is not fertilized, that is after ovulation. But if you did not ovulate in that cycle, your womb lining still breaks down after a while. This is usually called an abnormal uterine bleed, an anovulatory bleed, or a withdrawal bleed. It is not a period. So how does a woman know if she's not ovulating or having this kind of bleeding? Hello, my name is Stephanie Nyong, your cycle coach, and I'll be talking to you about 5 signs that could mean that a woman isn't ovulating. Irregular cycles is the first and most common sign of anovulation. In this case, you will notice that you have either very long or very short cycles. Cycles longer than 35 days or shorter than 21 days. Now, if you have cycles that are less than 21 days, it simply means that your body isn't getting enough time for the egg follicles to mature. The menstrual cycle has 4 phases, but if we were to divide it into 2 major parts, 2 major phases, we will have pre-ovulation and post-ovulation, that is before and after ovulation. The phase after ovulation until the start of the next period is called the luteal phase. Now, ideally, the luteal phase should be around 10 to 16 days. Well, if you subtract 10 to 16 days from a cycle that is 21 days long, we have a pre-ovulation phase that is less than 12 days. You need at least 14 days for the egg to mature properly. A cycle, on the other hand, that's more than 35 days, or cycle lengths that change month after month with at least 7 days difference, maybe an ovulatory cycle. So that's like 28 days this month. Next month is 35 days before your period comes, at least 7 days difference. No periods or skipped periods and you're not pregnant. Months pass and you don't get a period. You are not ovulating. Cervical fluid. As the fertile window opens in a regular cycle, your cervical mucus becomes wetter. You feel a lot of wetness down there. You see very clear, like egg white, slippery discharge that stretches about 3/4 of an inch, when you rub it on your fingers like this and attempt to separate it. So it could also be watery as well. Now, if you notice this from cycle to cycle, it could mean that you are not ovulating. If you are not seeing this quality of cervical fluid. Now, if you've been trying to conceive for a while and it seems like every other thing is fine and you experience this is something you may want to look into. So I'd leave links to videos where I've explained the different kinds of cervical mucus that a woman sees throughout her cycle and how you can tell them apart. The link will just be below this video or in the description. Make sure to check that out. Now, the next is no sustained raised temperatures in your cycle chart. If you watched my videos at all, you would attest to the fact that I love cycle charting a lot. It doesn't just help with timing sex or ovulation, but also points to irregularities with your cycle. Like I tell women, sometimes you have to go for multiple tests to check what the problem might be. But do you know that you can see some of these irregularities from your cycle charts right there in the comfort of your home, and it is very cheap. So when you chart your daily waking temperature, you'll see a pattern. Pre and post ovulation, just like this. Before ovulation, your waking temperatures usually are around 36.1 degrees Celsius and 36.4 degrees Celsius. If you use a Fahrenheit scale, that would be between 97 degrees Fahrenheit and 97.5 degrees Fahrenheit. But as soon as you ovulate, it rises between 36.4 degrees to 37 degrees Celsius, or 97.6 degrees Fahrenheit to 98.6 degrees Fahrenheit, depending on which of these scales you use. Because of the progesterone hormone secreted after ovulation, this hormone causes heat in our body. So it clearly tells you that you have ovulated in that cycle. Now, peradventure, your chart does not look anything like this. That's if you chart your cycle with sets of low and high temperatures before and after ovulation. It simply means that you are not ovulating. So a woman's chart that is not ovulating looks something like this. Charting your temperatures is easier than you think. All you need is a menstrual cycle chart and a basal body thermometer. We have a very short book that teaches you all about the primary fertility signs, temperature, cervical mucus and position, and how to use them when trying to conceive or just to monitor your cycle. The hard copy comes with a thermometer, so the link is in the description or just below this video. The last sign is multiple positive ovulation tests. So some of us may have used this at-home test for ovulation at some point, to test for ovulation. Others may not have heard about it at all, but I'll show you. So this is what it looks like, right? How does it work? You dip it in your urine and wait a few seconds for the result. A second line as dark as the control line tells you you'll be ovulating in the next 12 to 36 hours. So for some women, when they use these test strips, they see that they keep getting positive results on multiple days at different points in the cycle. This could mean that you are not ovulating. And it's very common in women with PCOS, polycystic ovarian syndrome. Their bodies attempt ovulation several times, but it doesn't get through with it. Like, it's wanting to ovulate, it's almost there, but it doesn't happen. Again, this is where charting your temperature comes in handy. So every other fertility sign tells you you're about to ovulate, like your cervical mucus, even the test strips, but only your temperature can confirm that you actually ovulated from sustained raised temperatures. Remember the last point I talked about this. So you may be interested in this particular topic because tests have shown you that you're not ovulating, or you just suspect that you may not be ovulating because you've been trying to conceive for a while, or you have irregular cycles. I'd always say visit a gynecologist, but most importantly, start charting your cycles. It will help you a great deal. How many times will you continue to go for tests and scans? It can be really expensive. Charting is cheap, and guess what? Even when you take medications, supplements, or other treatments, you can simply monitor your progress from your charts to know when you begin ovulating again. There are a list of helpful resources just below this video. Make sure to check them out. Would you like to speak to me about your cycle or any other symptoms you experience? There are links to book a call too. See you in the next video where I'll be talking about tests to go for if your periods are irregular. So if you haven't subscribed or tapped the notification bell, now is the time so you don't miss out. Cheers.